What is exercise? Exercise is a period of enhanced energy expenditure, and this enhanced energy expenditure it is made by many complex adjustment in the body, by the adjustment in the metabolism, respiration, circulation and the regulation of the body temperature. So exercise is a period of enhanced energy expenditure. Now why we have to learn about the exercise physiology? Because exercise it is helpful in the prevention of the cardiovascular diseases. Exercise it is useful for the evaluation of the cardiac and respiratory system, for the rehabilitation of the patient with the cardiac diseases, to improve physical fitness of person and to improve performance of athletes, military and the paramilitary person. And that's why we have to understand about the physiology of exercise. Now, first of all, let's understand about the grading of exercise by the WHO in 1978. So, exercise it can be classified in four grades. Grade 1 is the light exercise, grade 2 is moderate, grade 3 is heavy, and grade 4 is very heavy or the severe exercise. And it depends on change in the heart rate, oxygen consumption, percentage of maximum oxygen consumption, which is also known as relative load index, and the metabolic energy expenditure. Now the energy expenditure it depends on the oxygen uptake. So 1 MET is equal to oxygen uptake of 250 ml per minute. Now in the grade 1 exercise, which is the light exercise, heart rate they are usually less than 100 beats per minute and oxygen consumption is zero point 0.4 to zero point 0.8 liter per minute. In grade 2 exercise, heart rate they increase from 100 to up to 125 beats per minute and oxygen consumption is zero point 0.8 to 1.6 liter per minute. In the heavy exercise, heart rate they are within the range of 125 to 150 beats per minute and the oxygen consumption is 1.6 to 2.4 liter per minute. And in the very heavy or the severe exercise, heart rates they are usually more than 150 beats per minute and oxygen consumption is 2.4 liter per minute. Responses to exercise. So whenever we perform increase in the physical activity, it is the exercise and during the exercise energy expenditure increases. During the exercise muscle activity increases and because of the increase in the activity of the muscle it requires more amount of the oxygen, nutrients, blood flow. So more amount of the oxygen it is supplied by the respiratory system. So during the exercise respiratory changes they also occur. More amount of the blood flow it is necessary to provide oxygen as well as the nutrients for the increase in the metabolism during the exercise. So cardiovascular system it increases the blood flow to the active muscles. Now because of the increase in the metabolism as well as increase in the activity it generates heat and this heat it should be dissipated from the body. So body heat it also should be maintained during the exercise. So these are the various responses that occur during the exercise: changes in the muscle activity, change in the respiration, change in the cardiovascular system and change in the heat transfer mechanism in the body. Now in this lecture I will explain about the change in the respiratory system as well as the change in the cardiovascular system that occurs during the increase in the physical activity or the exercise. Now first of all let's understand various respiratory responses that occur during the exercise or the increase in the physical activity. So respiratory responses during the exercise they include increase in the oxygen consumption. And VO2 maximum is the maximum oxygen that can be utilized during the exercise. Pulmonary ventilation during the exercise increases to provide more amount of the oxygen to the tissues. During the exercise, oxygen uptake also increases in the lungs. So these are the various respiratory responses that occur during the exercise: increase in the oxygen consumption, increase in the pulmonary ventilation, and increase in the oxygen uptake in the lungs. Then Oxygen consumption in exercise, it is also known as VO2. Now normal oxygen consumption for a young man at rest is about 250 ml per minute. Now under maximal condition or during the exercise, oxygen consumption increases. In the untrained average male, oxygen consumption it can be increased up to 3.6 liter per minute. In the athletically trained average male, oxygen consumption it can be increased up to 4 liter per minute. And in the male marathoner runner, oxygen consumption it can be increased up to 5.1 liter per minute. So the oxygen consumption at the rest is about 250 ml per minute, but during the period of the enhanced energy expenditure or during the exercise, oxygen consumption increases. Now here in this graph we can see the recording of the oxygen consumption and the change in the physical activity. Now at the resting state, the oxygen consumption is about 250 ml per minute, and with the increase in the physical activity, oxygen consumption it gradually increases. Now the VO2 maximum is the maximum oxygen consumption that can be increased by the person. So here it reaches a plateau and this is the VO2 maximum. So VO2 maximum is the maximum oxygen usage under the maximal aerobic metabolism. So it determines the maximum aerobic capacity beyond which oxygen supply it cannot be increased. So anaerobic metabolism it provides more amount of the energy. So VO2 maximum is the maximum ability of the person to utilize oxygen during the exercise or the enhanced energy expenditure. So now one question arises, what limits the VO2 maximum or the maximum ability of the person to utilize oxygen? So maximum oxygen consumption or the VO2 maximum, it depends on various factors like tissue factors, number of the mitochondria in the cell affects the oxygen consumption, muscle mass, cardiac output, pulmonary ventilation, and the diffusion capacity of the lung. Now mainly VO2 maximum it depends on cardiac factors as well as the function of the respiratory system. Function of the respiratory system is the pulmonary ventilation and the diffusion capacity. Whenever pulmonary ventilation increases, it can increase availability of the oxygen in the blood and to the tissues. Increase in the diffusion capacity of the lung, it can also provide more amount of the oxygen in the blood and to the tissues. Now second factor that is the cardiovascular system. So the cardiac output is the amount of the blood that is ejected by both the ventricles in 1 minute. So cardiac output it provides blood in the peripheral circulation and to the tissues. So VO2 maximum it depends mainly on the cardiovascular system as well as to the respiratory system. Now the VO2 maximum it is limited by the cardiac output and not by the ventilatory capacity or the oxygen diffusion capacity, because the maximum amount of the cardiac output that can be achieved by the person it is limited. It depends on trained person and the untrained person. So cardiac output is different in the person, and the maximum amount of the cardiac output that can be achieved it is limited. So VO2 maximum is limited mainly by the cardiac output and not by the respiratory factors. Now let's understand what is the effect of training on the VO2 maximum. So here we can see the weeks of training and its impact on the VO2 maximum of the person. So as we can see that with the weeks of the training or the prolonged physical activity, it increases the maximum oxygen that can be utilized by the person. So aerobic capacity of the person increases with the training. Now VO2 maximum it increases only up to 10%. Greater VO2 maximum of the marathoner or the person it is probably genetically determined. Various genetically factors like the number of the mitochondria in the cell, chest size, vital capacity of the person, height of the person, these are the various factors that can affect the VO2 maximum or the maximum aerobic capacity of the persons. It is also observed that many years of the training, it can increase the marathoner's VO2 maximum by values considerably more than the 10%. So training increases the maximum oxygen consumption or the aerobic capacity of the person. Oxygen consumption and the total pulmonary ventilation at the different level of the exercise. So during the exercise, oxygen consumption increases, and along with the increase in the oxygen consumption, pulmonary ventilation also increases. So there is a linear relationship is present between the oxygen consumption as well as the pulmonary ventilation at the different levels of exercise. Both oxygen consumption and the total pulmonary ventilation increases about 20-fold between the resting state and the maximal intensity of the exercise in the well-trained athlete. So with the increase in the oxygen consumption, total pulmonary ventilation increases during the different levels of exercise. Now let's understand mechanism of increased pulmonary ventilation during the physical activity or exercise. So in this graph, we can see the relationship of the time duration with the change in the pulmonary ventilation during the physical activity. So during the resting state, pulmonary ventilation is about 4 to 5 liter per minute, and with the increase in the physical activity or during the exercise, pulmonary ventilation increases. Pulmonary ventilation it reaches at a plateau during the continuous physical activity, and with the stoppage of the exercise it reaches at a resting state. So during the physical activity pulmonary ventilation increases. Now at the beginning of the exercise this increase in the pulmonary ventilation is mainly because of the neural control mechanisms, because of the increase in the sympathetic output by the cerebral cortex as well as by the efferent impulses from the proprioceptors in the joints. It increases the pulmonary ventilation at the starting of the exercise. Now, whenever a person continues the exercise, then production of the metabolite it increases at the tissue level, which increases blood lactate, blood potassium, which stimulates respiration during the physical activity. Continuous physical activity also increases heat production, so body temperature increases. Increase in the body temperature also stimulates pulmonary ventilation. Decrease in the oxygen, increase in the carbon dioxide, increase in the hydrogen ions in the blood during the continuous physical activity, it stimulates carotid bodies, and by the stimulation of the carotid body, it also stimulates pulmonary ventilation. So these are all the factors that can increase pulmonary ventilation during the physical activity or the exercise. So normal pulmonary ventilation is tidal volume multiplied with the respiratory rate. Normally the tidal volume is 500 ml and respiratory rate is about 12 to 16 per minute. So normal pulmonary ventilation is about 6 liter per minute. And pulmonary ventilation at the maximal exercise it can be increased up to 100 to 110 liter per minute. So from 6 liter per minute resting pulmonary ventilation it can be increased up to 100 to 110 liter per minute. So it provides element of safety in situations like exercise at the high altitude, exercise under very high temperature, and the abnormality in the respiratory system. So during all this condition, it can provide element of the safety because breathing reserve is usually more than the resting condition. Now, respiratory system is not normally the most limiting factor in the delivery of the oxygen to the muscles during maximal muscle aerobic metabolism because it can increase up to 20 times and it can provide more amount of the oxygen by increasing the diffusion capacity as well as the increase in the pulmonary ventilation. So, respiratory system is not the limiting factor in the aerobic metabolism. So, during the exercise, VO2 maximum or the oxygen consumption it increases during the exercise pulmonary ventilation increases and during the exercise oxygen uptake in the lung it also increases because during the exercise cardiac output increases and increase in the cardiac output it increases the pulmonary perfusion. Because of the increase in the cardiac output it increases the pulmonary blood flow, and this increase in the pulmonary blood flow it opens up the new capillaries, and opening of the new pulmonary capillaries it increases the surface area for the diffusion of the oxygen. So pulmonary diffusion capacity also increases because of the increase in the pulmonary surface area. And during the increase in the physical activity, alveolar capillary PO2 gradient also increases because of the increased oxygen utilization in the blood and increase in the carbon dioxide production. So because of that, alveolar capillary PO2 gradient increases, so oxygen uptake in the lung increases. So these are all the factors that can increase oxygen uptake in the lung: increase in the pulmonary perfusion, increase in the capillary PO2 gradient, and increase in the pulmonary diffusion capacity. Now the oxygen diffusion in the non-athlete at the rest is about 23 ml per minute, and the non-athlete during the maximal exercise it is about 48 ml per minute. In the speed scatter during the maximal exercise, oxygen diffusion capacity it can be increased up to 64 ml per minute, and in the swimmer during the maximal exercise it is about 71 ml per minute. So we can see, in comparison with the non-athlete as the rest or during the maximal exercise, oxygen diffusion capacity it is more in the trained athletes and it can be increased up to 71 ml per minute. Now let's understand physiological effects of exercise and oxygen deficit. So here we can see the time duration and its relationship with the oxygen consumption during the physical activity or the exercise. So at the beginning of the exercise, gradually the oxygen consumption it increases and it reaches at a plateau, and with the cessation of the exercise, oxygen consumption it gradually decreases. So we can divide the physical activity in three phases: adaptation phase, steady phase, and the recovery phase. Now first the adaptation phase. So adaptation phase is the beginning of the exercise. So at the beginning of the exercise or the increase in the physical activity, more amount of the oxygen and the nutrients they are needed in the active tissues. So our aerobic capacity it is gradually increased, and this aerobic capacity it is increased by increase in the respiratory rate, increase in the diffusion capacity, increase in the cardiac output. But all these mechanism they take some time to increase oxygen supply to the active tissues. So all this metabolism during this phase it is provided by the anaerobic metabolism over the available aerobic capacity. So it produces deficit of the O2, and this deficit of O2 it is paid by the anaerobic metabolism and it is known as oxygen deficit. Now during continuous physical activity during the steady state, all the body mechanisms they are working at the optimal state to provide enough amount of the oxygen to the active tissues. Now this enough amount of the oxygen it is provided by the maximum amount of the cardiac output, maximum increase in the diffusion capacity in the lungs, as well as increase in the pulmonary ventilation, so it reaches at the optimal state. So this is the maximum oxygen consumption by the person during the aerobic activity. So during the adaptation phase, gradually the oxygen consumption it increases and it reaches at the optimal state in the steady phase. Now both during the adaptation phase as well as the steady phase, the energy requirement beyond the oxygen supply or the maximum oxygen consumption is by the anaerobic metabolism, and the oxygen deficit occurs at the starting of the exercise during the adaptation phase. Now during the recovery phase, the exercise is stopped and gradually oxygen consumption it decreases and reaches at the steady state. So it is the period after the cessation of the exercise during which extra amount of the oxygen it is consumed. So this extra amount of the oxygen that is consumed during the recovery phase it is known as oxygen debt. During the adaptation phase, oxygen deficit occurs which activates the anaerobic metabolism, and to replenish all the oxygen deficit that occurs during the adaptation phase, oxygen debt it is fulfilled during the recovery phase. So this extra amount of the oxygen it is consumed during the recovery phase to remove excess lactate, to replenish ATP as well as the phosphoryl creatinine, and to replenish oxygen in the myoglobin. So oxygen debt it is fulfilled in the recovery phase during the physical activity.